Good morning, everyone. My name is Karishma Shah, and my project is entitled Subjective Autonomy Among Patients with a History of Trauma. So just before we get started into the results and discussion portion, I would like to talk about some background details of my abstract. So this was conducted in Kansas City, Kansas at the JayDoc Free Clinic, which is the largest student-run free clinic in the entire United States. We treat almost 2,000 patients a year, and that's something we're really proud of. The JayDoc Free Clinic serves under the purview of the University of Kansas School of Medicine, at which I am a second-year medical student. And I also had the privilege of serving as the Director of Finance at JayDoc for the last year. I was studying patient feelings of autonomy while in the clinic, and I gave the survey out to about 208 patients at JayDoc. The survey was written in English and then also converted into a Spanish version, so it was given to patients who read and speak English and Spanish. It was a 10-question Likert survey. The first few questions were evaluating a patient history of traumatic experiences, and then the last few questions were about the patient experience, including if providers introduced themselves, if they felt safe, and if they had feelings of autonomy, which was measured by a patient's comfortability rejecting a provider's touch. And then finally, the reason I performed this study was, of course, to provide the best care to the patients at JayDoc Free Clinic. This is a pretty unanimous goal around all providers, is to make sure that we are doing the best we can to care for our patients. So the results of this study are, here's the main points. Almost 18% of patients at the clinic reported a history of trauma or abuse, which is a very high number. About 35% of patients, all patients, regardless of their history of trauma or abuse, stated that they would feel uncomfortable or just neutral rejecting a provider's touch. And I count anything less than feeling comfortable as a diminished sense of autonomy. So that was the threshold I used in this survey. 38.5 patients who had a history of any kind of trauma stated that they felt neutral or uncomfortable denying a provider's touch. And the second question on the survey was specifically if they had a history of sexual trauma. And so when survivors of sexual trauma were isolated from the group, the number of people who felt less than comfortable increased to 44.4%, refusing a provider's touch or their ability to do an exam. The final question on the survey was that asking patients if they felt safe while in the clinic. And I'm happy to report that this number was very high at 97.5%. But of course, this number should be 100%. And so I know that my clinic will continue to work to make sure all patients feel safe while in clinic. Finally, the conclusions that I came to were that patients with and without a history of trauma both report a diminished sense of autonomy, but that number is higher for patients who have a history of sexual or any kind of trauma. I would like to do further research or have the new JayDoc Executive Board continue my research to see if these senses of diminished autonomy are because JayDoc is a free clinic and most of our patients do not have insurance and thus lack access to mainstream healthcare. And maybe they feel coerced or that they have to do what the doctor says at this free clinic because they are receiving healthcare for free. And so I would like to make sure that these patients do not feel more coerced than their peers and colleagues who have better access to healthcare based on financial means. Thank you so much for listening to my presentation. I look forward to meeting you all in New Orleans.